Try adding radio or on Apple Podcasts.
Have you become a member yet?
With a 50% obesity rate in the U.S. and more unhealthy people than ever before, it is time to make America healthy. Welcome to Make America Healthy with Beth Shaw. If you're feeling tired, toxic, heavy, slow, or stressed, then keep listening. Beth and her expert guests are here to offer practical advice and share the tools you need to reclaim your physical, mental, and emotional health. Now, here is your host, Beth Shaw.
Hey everyone, and welcome to another episode of Make America Healthy, where our goal is simply to educate you, inspire you, enlighten you, and give you more tools so that you can take better care of your physical and mental health. And yes, it's still May, and it is still Mental Health Awareness Month. So we're focusing this month on Make America Healthy on your mental health, bringing on experts that are going to give you insights, information, and perhaps educate you on some things you weren't even aware existed as it comes to taking care of your mental health. So today we are joined with Dr. Martha Koo, who is the founder of Neuro Wellness Spa, medical director of the Clear Recovery Center, and certified psychedelic assisted therapist and researcher. She completed her undergrad at Princeton, her medical training at UCLA, her residency in psychiatry at UCLA. She's double board certified. She does things for MAPS that she will explain. And she is also a pioneer in transcranial magnetic stimulation, TMS, which is going to be really interesting for all of us because it is FDA approved and your insurance may cover it. She's the founder of this Neuro Wellness Spa, and she is doing a lot just in the space of mental health with a very wide variety of treatments. We are also joined by Faust Ruggiero, whose professional career spans 40 years. He's a published author, clinical trainer, and therapist who has worked in settings with deaf children, in prisons, nursing homes, substance abuse centers, inpatient facilities, and he runs the Community Psychological Center in Bangor, Pennsylvania. He also has a counseling program he designed, and he has a lot of credentials as it comes to mental health. So welcome to both of our guests. Dr. Koo, I would love to start with you. We were chatting a little bit before the show about TMS, which we have not had anyone on Make America Healthy really cover this, and your neuro wellness spas. So why don't you just tell us how you got started in the field and how you have ventured off to so many interesting paths, from ketamine to psychedelics to magnet therapy. Seems like you're really running a very wide road when it comes to mental health treatments.
Thank you so much, Beth. I really appreciate the lovely introduction, and I definitely feel honored to be on your show. I really enjoy your emphasis on the mind-body connection and the importance of, right, we can't really have good physical health without good mental health, and vice versa. And yeah, people ask me that a lot because I seem to cover a broad territory. And I think there's two reasons for that. There's so much we don't know about mental illness. And I think we tend to lump, as if we want to say specifically looking at depression, right? We lump a lot of people into a diagnosis of depression. And I think we know enough in modern neuroscience to understand at this point that it's probably not only multifactorial, but we're probably looking at more than one disease. And so there isn't a one size fits all. And I have always striven in my career to help people to really with the goal of getting people into full remission. And in that vein, the more opportunities I have to offer as treatments for individuals, I feel the better outcomes. And so, yes, I started my practice. I chose psychiatry just because when I hit my, specialties in medical school, I fell in love with psychiatry. And I think I fell in love more with people, right? And humanity, and how people are so different in terms of how they react to illness, and understanding their dynamics in terms of that responsivity to interventions fascinated me. And I initially hung my shingle as a psychoanalyst. So after my residency, I did psychoanalytic training, and I spent a good 15, 20 years treating people with medications and depth therapy, psychoanalysis, and just psychotherapy. And a lot of people do get better, right, with meds and therapy, but there was a certain group of people that still weren't in full remission. And I had been tracking transcranial magnetic stimulation and the science behind that. And so when that became FDA approved in 2008, I opened a separate company to offer TMS to patients. And then that's just inspired me to stay sort of on the cutting edge, and adding when IV ketamine came out, and now Spravato, and even looking at the psychedelics. So really the goal is to stay with the science, and stay with being able to offer people a lot of alternatives so that they can be the best selves that they can be.
Well, I just want to commend you for that. I think that a lot of doctors do just stop with traditional pharmaceutical medications and therapy. And just in my own personal experience, that falls short. You mentioned something, you said full remission, and I'm very curious as to what that means to you in your professional opinion. And I will just base that on, we were talking before the show, I shared with you, I've been on and off of antidepressant medications for the better part of 20, almost 20 years now. And I'm off. I would like to stay off. I've done 6 rounds of ketamine. I've done different plant medicine modalities. I'm very curious as to what else is out there. And it's not that I don't feel good now, because I do, which I'm so happy about. But, I exercise every day. I do yoga, I meditate, I eat very clean. I don't drink much alcohol, all of those things. But I'm curious to go further. One, because I'm just curious, and two, because I don't really know what full remission looks like. And while I'm not, wishing or hoping or expecting to be like happy all the time, if I can continue to up my mental health, much in the way I've managed to in my 50s be at 16% body fat with 71 plus pounds of muscle on my body, which is a record for me. I'm almost hoping that if I could do the same thing with my mental health, and then of course my cognitive health, then I'll be defying the odds. Tell us what full remission should feel like for people, and what people could expect, and where maybe they should stop, or perhaps in a case like mine, where we should just keep going.
There you go. That's an excellent question. And there's really a couple ways to answer that. In pure research studies, we define remission really based on very objective rating scales, right? So we can give you like a PHQ-9 as an example, patient health questionnaire, and you would fill out that yourself and mark certain symptoms that you're having or ongoing issues. And then it's ranked by a score in numbers, and below a certain score would be considered remission. And it's what you point to. We don't all feel 100% every day. We don't all feel great every day. And there's a difference between happiness and what I like to use the word content, right? But also a difference between content and a medical illness. So full remission, though, in a subjective sense, I think this is where we're looking at the whole person, right? And so to me, it's like a biopsychosocial, and I consider spiritual realms. And so to me, when someone's in full remission, we've done enough on maybe the medical intervention side, right, to treat their medical health. So that's maybe an antidepressant, maybe with therapy, maybe with also TMS or IV ketamine or Spravato. But then we've also helped them in the other arenas, right? So people, to feel, I think, fully in remission, we need to feel we have a sense of purpose and that we're succeeding in life, whether it, and usually that's, go back to Freud, it's pretty much love and work, right? It's the concept of relationships, and work doesn't necessarily mean a job, right? It can be raising a family, it can be a volunteer position, but a sense of purpose in our life, and I think a sense of relating to others. And when we have all that going well, I think most of us feel like we're in remission. And then even more specifically, I think you said something beautiful, which is yourselves best. And so if there's a sense of, oh, there still could be a little bit more, I would always urge people to seek that. Like, to me, it's an ongoing process. Like, we never can stop working on ourselves. There's always ways to improve, always things to learn. But it's important you say it that way, because I work with a lot of people that have been depressed for so long. This is why we end up with a lot of people in partial remission, because they feel better, but I don't think they really understand what it is to feel completely better. And they need somebody a little objective to help with that. And there is a difference between partial remission and that full remission feeling.
So on that note, I have heard people say, if you just give someone an antidepressant pill, you're treating the symptoms, you're not getting to the root of the problem. Whereas from what I understand, and you could, probably clarify this, things like ketamine, some of these other psychedelic assisted therapies, ayahuasca, help one get more to the root of the problem, so that people have the hope of making that positive change at the root. What are your thoughts on antidepressant medication versus some of these more cutting edge treatments?
So I do think medications have a place, right, for people, and it is a small minority, but there are some people that will do very well on medications. And when I consider well, it's what we're talking about. It's not just that they're on an antidepressant that's efficacious for them, that's working, but we also would want no side effects. And I think that's the tall bar when it comes to antidepressants, because that's a quality of life issue. But in general, there's a famous study, the STAR*D trial. Most people are familiar with it. It was the largest study done by NIH, and it pretty much showed when we start people on antidepressants, about 30% of them would get into what we consider in remission, right? That's not very many. That leaves 7 out of 10 people, right, walking around still depressed. And I would even argue, pardon?
Isn't it also true that prescribing different pharmaceutical medications is kind of trial and error, right? You don't know if Prozac's going to work for someone. Wellbutrin, Celexa, Zoloft, Paxil. I mean, and Lamictal, the list goes on and on and on. Yes. So many times for a psychiatrist, it's trial and error to just see what's going to work.
Yes, you're absolutely correct. We have some pharmacokinetic guided interventions we can do now, where we can send saliva, but it's definitely not, there's not enough data to say this medicine will absolutely work for an individual. There's some to show, like, based on your enzymes, maybe preferably use this class of medication. But yeah, bottom line is still like a guinea pig, I tell my patients, and we pick one based on side effect profile and symptoms, and we put somebody on it. And then the drill. It's they have to get on it. Takes a week or so. Wait 3 to 4 weeks till it works. If it doesn't work, you can increase the dose. You can then add something from another class. So we don't meds are a resource. They don't get the vast majority of people into remission. So that's where your question comes. I think these alternative treatments are really important. And when you talk about the root of the cause, we know so much more now, like as transcranial magnetic stimulation really helps the way our neurons communicate. It's making network neuronal communication changes in the brain, which I think is more of a getting to the root versus just changing the amount of like neurotransmitter, right? Dopamine, serotonin, norepinephrine that the neurons are using. So I think it is a deeper strategy. And then I am one that I always feel people need, everyone should go to therapy, right? Because despite a medication, despite if the medication treats your depression, there's other things in life that have happened, probably based on being depressed. and impacting work, relationship, self-esteem. And I think the therapeutic component is really important. And that's where some of these processes like IV ketamine come in, or if you're saying the psychedelics give us an opportunity for some more depth therapy in combination with these neuroplastic and network neuronal communication changes that are happening in the brain.
Wonderful. So I have a friend, he lost his mother when he was 17. He had some kind of an episode, a manic episode or something. They diagnosed him at 17 with bipolar. They put him on Lamictal and maybe Prozac, something else. And he is now 60 years old and still on the same medications.
Wow.
And he's also now curious about maybe doing some plant medicine, which you can't do on some of these harder drugs. If one is diagnosed at any time in one's life, is it I don't want to use the word sentence, but I'm going to say, is it a death sentence? Is it you're going to have this diagnosis for the rest of your life? People need to be reevaluated along the way. Is there a chance for my friend to get off the medication he's been on for the better part of 43 years?
Absolutely. So I think, just speaking in theory, I can't comment on specifically, obviously, him as an individual. I haven't evaluated him, but in essence, everybody should continue to evaluate their needs in terms of a medication as well as their diagnosis. Right? Sometimes we're misdiagnosed, especially under really stressful circumstances, right? This is the one thing too, diagnosis in psychiatry is based on syndromes. We can't draw your blood and give you a diagnosis like with cancer. We can't do an x-ray. And so it's a conglomeration of symptoms that somebody presents as, and there are some illnesses that can present the same subjectively that have very different causes, right? And so I think it's always important to reevaluate, and it's definitely important not to just stay on a medication for 30, 40 years, right, without even really re-examining the need under close medical supervision, meaning that we develop better coping skills, right, or we're in different social situations that support us. And as you know, right, with your practice of yoga and all the exercise or our nutrition, right, our socialization, like sometimes those are enough interventions, even if somebody has like a major depressive episode. Maybe it's on a milder front. They've had stressors. They've needed a medication or TMS to pull them out of it. They're in remission. They've been in remission for a year. And now maybe they have all these other supports in their life. Those are enough to keep somebody in remission and not necessarily need to be on a medication, right? And so you do sort of a slow taper, and you under the medical supervision, and you evaluate how somebody's doing, and you pretty much get your answer, right? So
Recently, I've been on some medications that when I weaned off of them, I didn't feel any different at all.
Great example. Yeah.
And, much like someone who is embarking on a weight loss program, if you have 100 pounds to lose, your diet and your exercise program is going to look different than when you have 50 pounds to lose and then 25 pounds to lose and the ever-present 5 pounds that a lot of us battle with. So, things change over the course of time.
And then just what somebody needs, right? As you say, to stay stable then with their weight, and learning what that diet is like is also different than when they're trying to lose the weight. Right. And so it's understanding what's needed for maintenance health. And I think that begs the question of, is the medication still warranted, or what is needed? And that should be assessed. And our needs change over time, over our lifespan, with our biology, and I think with our coping skills and our social resources.
Thank you for that. As a medical professional who is engaged in the TMS, the magnets and ketamine clinics, do you have a preference of one route or another? How do you guide people as to should they try everything? If they find that they, for some reason, don't want to take medication, or they have side effects, or the medication's not working, what roads do you suggest some of our listeners might take who, again, want to walk a different path.
Yeah. I always put TMS first. I mean, I say always with parentheses. There's only one absolute contraindication for transcranial magnetic stimulation, and that's if you have ferromagnetic, so magnetic material in your head, you cannot do TMS, and that's really it. And the reason I say TMS is a go-to first is because for the vast majority of people, it's covered on insurance. It's an outpatient procedure. There are really no side effects. Sometimes there's a little headache, a little scalp discomfort day 1 or 2. It goes away with treatment. It's more than twice as effective as medications. We have really good remission rates. And so, and there's so much data, right? FDA approved in 2008, but TMS itself as a mechanism has been around since the 1980s. We initially used it for brain mapping. So the safety and efficacy profile, we have years and years. I really do strongly believe in the IV ketamine also and Spravato, but the reason I would put that second is literally based on, with the IV ketamine, it's not covered by insurance. And the process is a little different, a little bit more intensive, meaning you can't drive yourself to and fro, right? You need a ride at the end. You're not supposed to drive for 24 hours. You come into the clinic for maybe an hour and a half or 2 hours each time, different TMS, you're in and out in 20 minutes. So I think just cost and ease of the protocol, but those are still really valuable treatments. But if I were going to order them, right, this is why I typically put the TMS first as an FDA insurance, FDA approved insurance covered process with a very easy, you can fit it into your lifestyle without change. It to me goes sort of to the top of the list.
Wonderful. I'm obsessed with data. I use an in-body machine at one of my doctor's offices, like at least once a month, if not every 2 weeks. So I'm curious about brain mapping, whether it's a QEE, is it QEEG?
Oh, yes, EEG, right?
Or the SPECT scan, which I had at the Almond Clinic years ago.
I know the Almond Clinic, yes.
Yeah. I'm wondering, do you do before and afters for people so that much like a machine that measures your body fat to muscle ratio and all of that, are people able to see differences in their own brain, whether on ketamine or doing the TMS?
Yeah. Oh, that's an awesome question and led right into something actually we didn't talk about, or you and I talk about even prior, but there's a very specific kind of TMS called magnetic e-resonance therapy, uses the exact same FDA approved device. It's the same technology, but for that one, we do quantitative EEGs and we do baseline EEG. It guides the TMS for a specific protocol, say in terms of where to place on the brain, the coil, as well as the frequency we're treating. And we do track those every 2 weeks. And patients love that because they can really see how their brain is changing and it typically matches how they're feeling. We tend to use MERT more often. It's more brain driven, but we think of global diagnoses, traumatic brain injury, autism, cognitive decline, PTSD, ADHD, learning differences. With the regular TMS, we don't do any brain visual mapping, any EEGs or functional MRIs, but we calibrate the device to each individual's head. We do that by finding a mapping in terms of where we get a motor movement in the hand. And so that helps us place the coil over an area. Obviously, we're not treating motor neurons, so over an area that has to do with mood and anxiety regulation. And we use those objective depressive rating scales as a tracking measure for their outcomes in terms of the regular TMS.
This is all so fascinating. I'm going to jump over to Faust. I hope I pronounced that correctly. Faust, welcome to Make America Healthy. You are a mental health practitioner. I especially am curious as to the work that you've done with the deaf and in prison populations, because we don't get to focus on those two populations very much on Make America Healthy.
Beth, thanks so much for having me aboard today. It's a pleasure to be with you. I'm kind of on the other end of Dr. Rue, and I have my group of people who do all the things that she does, and then they get them back to me, and we dig into all those good life things that that are making things difficult for people. And when you can put those two things together, you really have a nice plan, because all the methods that Dr. Wu's talking about really kind of prepare the palate for me. They just get all that stuff and put it in place. Now we get into those life circumstances. The deaf people I saw as a very young person. I had a family member who was treating deaf people, and these were profoundly deaf, but not completely deaf. So there was some residual hearing, and they wanted someone to come in and do some of the behavioral work, because a lot of the cognitive workings of the mind change when we have one sense that's not working well for us. I mean, everything changes, personality changes, behavior changes. You're just not getting a huge part of information. So it was my job to get in there and just start working with, at that time, with kids, and start doing some things to help them normalize some things. So some of that was about changing the delivery. We worked with the school systems and got them in there. A lot of our kids went back into mainstream, so we got them. They were hearing well enough that they could go into school systems. And then the goal to mainstream if we can. There are other places where you're getting into sign. Those are not the people that I dealt with. I dealt with kids and adults with residual hearing. As far as the prisons are concerned, that was the life-changing thing for me. That was get in there, and all of a sudden you're seeing a completely different side of life, which by the time I was there 2 years or so, I realized it was not that different. The prison was what's different, but the people were not that different. All the things that we're thinking, what we're talking about today, are occurring there. They're just in a confined space. That's all.
Right. I have a funny prison story. I was trying to, when I'm not hosting this show or writing books on health and wellness, I am the CEO and founder of Yoga Fit Training Systems, which is the largest yoga mind body school in the world. We've been a school for over 25 years. And during the pandemic, I decided maybe we can get Yoga Fit into the private prison system, because I had this utopian viewpoint that, if I could just get in there, we could get some trainers in, teach some classes, people would start meditating, they would start doing yoga in their cells, they would find enlightenment and change their karma for many lifetimes to come. And then because I reside in South Florida, I met with this private prison company, and they were going to send me into the prison with the sex offenders so that I could do a tour, with the hopes of maybe we would start by training the prison guards in yoga and other mind-body tools. And I had previously done some work with prison guards at Rikers Island when I was living in New York. So I thought, okay, I can't ask anybody else on my team to go do this without me going to do this. And I was all set to go and tour this prison. And I had my outfit planned, which included like pulling my hair back, putting on some thick dark glasses, and wearing basically a potato sack to this prison. Unfortunately, or maybe fortunately, that never manifested, because I also thought maybe I'm a pretty sensitive person. Maybe it wasn't a good idea to kind of put myself in that consciousness. So it never happened, but I'm wondering, in your experience working with prisoners and giving them insights and aha moments and little opportunities for self-reflection, how do you think yoga and meditation would go over in the prison setting? Do you think people would, a certain percentage of the inmates would really fall in love with it and adopt it as a practice and shift their consciousness? Or do you think that in that environment it just wouldn't go over very well?
No, it's a great question. When I was there, I was seen as an innovative person in the prison system. And we did some of that. We had some people come in, and we started with the women, actually, with yoga. Men, that obviously that's the stereotype. And they really took to it. we took a group of about, I think it was 12 men, and tried yoga with them, and they took off with it just like the women did. Prisons are very structured, very inflexible, typically very inflexible system to work with. Once you sell it to the treatment staffs, and the wardens tend to be a little more power people in jails, but the treatment people will embrace it. And there are so few programs in prison, they'll often offer those programs. The one I put in years ago, some type of variance of that still runs today, and it does great work. The only thing about prisons is that no one offers the program. We haven't gotten far enough away from the let's punish the people part of this and get back into the rehabilitation and things.
Well,
And,
I mean, many would say that that system is a business, and just like very few entities and organizations in our society profit off of healthy people. And there's a lot of money to be made with sick, unhealthy people. And I think we could circle back to early education and see that we're not teaching anyone in the US to be really healthy and to exercise, and they're cutting back physical fitness programs left and right, and eliminating free time and all of that. Perhaps there is really no desire to have a certain amount of healing happen with these individuals.
well, and there isn't, it's not like when we offer programs for help, they're at the front of the line, they're at the back. So you're going to see some of those things. The other thing that I've noticed, and this is not only in jails, throughout societies, we've become a very quick fix kind of a nation. We talk about medications, or we talk about all the various things that give you a very quick push, and that's what people are looking for. But the bottom line is, if you're going to be healthy, it's a day-to-day enterprise in your life. It never stops. I'm in my late 60s. I do all the things we're talking about, including workout like you do every day. That's a mainstay in my life. Still has been. You were talking body fat. I'm at 68, a male, and I'm just approaching 20% body weight,
Okay.
and I work out, and the muscle tone is there. But when I sell these things to people, and I tell them that, what we're trying to do is just back to the same old homeostasis, the stuff we've always talked about. We're talking physical, intellectual, emotional, spiritual. Get those things balanced. If we can balance those things, you're going to feel good. It takes some time. Some people will need medications and other approaches, and that's fine. But I don't think we ever move away from a lifetime program that the person works every day. And the key is that it should be fun. You should be doing this and saying, these are the things I'm building into my life. I enjoy. It's going to be work, but that's okay, because the outcome far outweighs all the work.
Exactly. Thank you so much for that. Dr. Koo, on the note of prisons and pharmaceuticals, I read somewhere once that the state of California is the biggest consumer of pharmaceuticals for inmates. Have you heard anything like this?
Really interesting. And, sorry, no, I have not really, it's not my area of expertise in terms of the prisons. It doesn't surprise me. I'd be curious of the stats in general of California versus the other states. But yeah, it's a huge problem, I think, in general, in that population, in terms of getting them access to care that would truly help, right? Them feel better and reduce recidivism rates. I think I do know the prisons are greatly just overcrowded, and I think it's a problem in general. It's the same. It's a microcosm of out here, where people can't even access services, right? Even people with insurance in California, when they try to call off a new psychiatrist or therapist, there's a long wait list to get in. And so I think we really struggle with supply and demand in all fronts. And maybe it's very easy to throw a pill at somebody. So I'm not surprised, perhaps, to hear in the prisons that there's very high utilization, and I think it's maybe an unfortunate but quick way to check a box and perhaps do something. But I might, if there were the time and resources, we'd really like to evaluate, what they're really doing.
Do you ever see or foresee a time where things like ketamine or magnet therapy would be available. One, to people who can't afford them and probably need them the most, and two, people who are incarcerated.
Yeah, I do think there's a time. I mean, I'll tell you two sort of, I love your stories. So two sort of interesting stories. Well, one just fact and one interesting story, but I'm on the board of directors of the Clinical TMS Society, which is the largest professional society of TMS providers. And we just created a FACT TMS, which is a foundation. It's a nonprofit. And the goal is going to be, putting outreach out there to provide TMS to underprivileged areas or underserved areas. And so I know the movements are there, and we certainly have a big now organization with that goal in mind, education awareness and underserved areas. But at the latest annual conference, we got to see a wonderful presentation of some studies they're doing with NASA of TMS in zero gravity,
Oh, wow.
right? And looking at the changes and with the idea of, we may be sending people on long journeys to Mars, and the moon. And what are we going to do for mental health, right? There aren't going to be doctors to service everyone. And if we can create these helmets, right, that we know can be calibrated and work, right, as TMS does here on Earth, like that is a really good utilization of providing some mental health in a non-pharmaceutical and very safe, right? We don't need to worry about other, drug interactions, things like that. So yeah, I do think that with time, we're going to look back, just like we probably look at, lobotomies, and we put people in hypoglycemic, comas to treat. And now we look at those as so barbaric. I think we might not look at as barbaric. Yeah. There you go. We're gonna, I think, look, in whatever, hopefully less than 100 years, though, we'll look back and look at some of the things we do now and scratch our heads.
MAPS is such an interesting organization. I've been following them before I even really knew what they were. I've wanted to go to a MAPS conference at least for 10, 15 years. And again, I didn't know that much. And then when I moved to New York, I had the opportunity to meet a bunch of people from MAPS and go to some fundraisers. And, they have really shifted the market permanently. And I guess once you've taken the cap off that bottle, nobody's going to be able to put it back on. Can you tell us what's next in that whole realm of psychedelic assisted therapy? And I have not actually done those two things together, but I'm super curious to find the right practitioner and do all of it, because talk about getting to the root of things and having a dualistic approach simultaneously. I can think of few things better for mental health in my own journey. I'll say that.
Yeah, I think well said. And I know you shared on other episodes your ayahuasca journey. So, plant medicines have been used for millennia in a variety of ways. And in the 1950s, there were some really good studies, mainly with psilocybin and LSD for alcoholism, psilocybin for end-of-life distress. With really good outcomes, and just with the war on drugs in the 60s and really having nothing to do with actually the psychedelics, but really more issues with politics and Vietnam and all of those uprisings. The government shut everything down. So MAPS has been, I think, a crucially important organization. Rick Dobson founded it to really keep psychedelics in the process. And so where we are now is they've finished their really FDA approved phase 3 trials with MDMA, particularly looking at MDMA for PTSD, although they have many, many clinical trials going on for other indications. And the hope, right, is that MDMA possibly could be FDA approved in 2024, and psilocybin, hopefully follow shortly after. There are advantages with psilocybin. It's shorter acting. It has a little, they're all very safe.
And also MDMA, from what I've heard, gives you kind of a low the next day. So I would imagine that even if you were doing an MDMA assisted therapist with someone who's professional, you're still going to be at risk of having a pretty down day the next day, whereas psilocybin doesn't create that. Is that correct?
You're absolutely correct. And so it doesn't happen to everybody, but yeah, MDMA works as different mechanisms of action. It has an amphetamine base also and a surge of serotonin. So a little different risk profile also, right? Than psilocybin, generally safer, working as a serotonin agonist and a shorter protocol. And you said the most important thing is the right provider, because I think the risk of this big movement is people appreciating that it's the point of the psychedelics, I think, and how they work is really they're a vehicle. They're not a treatment perhaps in and of themselves. There's an important set and setting component to the process. There's preparation that should happen. There's integration that definitely should happen after. And so I've seen some sad cases of patients that have come to me, come for TMS after they've gone on a journey with an outfit for a weekend, and significant trauma came up, significant memories came up, and then they were plopped back at home without any resources. And so I think that it's really important for people to understand that I think the psychedelics are going to have an amazing therapeutic space for individuals and our community, but it is important, right, to do it in a therapeutic way. And that's different from just it as a party drug, right?
Yeah. So those of you who are listening to this show, if you're going to walk down any of these roads, make sure that you're doing it with a certified professional. Do not try this at home on your own.
Awesome.
Make sure that you're going to a professional. And I also have a question, because I know that we have a veterans program at YogaFit called our YogaFit Warriors program, where we deal using yoga and other mind-body tools to help veterans, first responders get trauma out of their physical body, sometimes without even having to talk about it. And it's been very successful. We're celebrating 10 years of doing this program. I know that they've been, Rick Doblin and his crew have been doing a lot of different studies with both psilocybin and MDMA for veterans. Again, how do they know which path to take? And what do you think one is superior to the other when it comes to dealing with hardcore trauma?
It's a great question. I think we don't have the data with that. They chose MDMA because they had the pharmaceutical source for that initially. And it's really important in research to make sure you're using the same, MDMA. And I think Rick had access to all of that. Now they do have obviously access to same grade, same source psilocybin too. But I think that was perhaps the start. And MDMA, we consider it a little bit of a heart opener. And I think when we're dealing with trauma, the capacity to have some self-compassion and self-love is an important part in healing. And so I will say the data is not out, right? We tend though right now to look at MDMA for trauma, MDMA for couples work, and there's a little bit of a bias for psilocybin for depression, anxiety, end of life distress, addictions.
Even Mel Robbins, the speaker, talks about doing MDMA assisted therapy with her husband. I think they do it every couple of months, and I think that's awesome.
There you go. Yeah. Yes.
Yeah. So Faust, are you working on anything right now that intersects with some of these new paths in mental wellness?
Beth, I don't spend a ton of time with the medications and those approaches. And I have people that do that. I tend to, I'm more the therapeutic model. I have the program, the process way of life, which I put together, and we work with that. There's a new book coming out, anxiety. We're expanding the program into a series of books, so that's coming out in the next few weeks. But as far as the medications and those types of things, again, I leave those into the hands of the professionals to do that.
Wonderful. Dr. Koo, what can we look forward to just in terms of a bright future for a nation that very much right now is under siege with probably more mental health issues than ever before. Are you seeing a way out for people? Do you think, May is Mental Health Awareness Month? Having shows like this, talking about things, I've opened up on social media about my different journeys and challenges. As we normalize more of these practices, do you see that more healing will occur? And do you think that our mental health is severely degraded as compared to perhaps 10 or 20, 30 years ago as a nation?
So yes and yes. I'll go to the second part first. I think currently, as everyone's aware, unfortunately, we do consider it a mental health crisis. Obviously, the pandemic didn't help, but I'm very hopeful for mental wellness for America and hopefully the world. And the reason is because I do think that one thing the pandemic did is it greatly increased awareness and destigmatized, I think, people talking about mental health issues. I think we did incorporate technology with telehealth that's allowed much greater access. And so I think the word is out. People are talking about it. People are less afraid of talking about their mental health challenges. And I think we have great minds that now are coming up with all these different interventions, which I do think is going to include greater access to TMS with less insurance requirements. I think Spravato's hit the scene. We have new, even, pharmaceuticals. We have neurosteroids coming out. People are looking at those. We have a lot more of the glutamate modulators rather than the specific norepinephrine, serotonin, dopamine ones. And so I think there's new interventions. The technology we have to look at the brain, it is just increasing every day, right? Our capacity to even look down at the neurons and neuroplasticity on a dendrite level, like the little fingers of the neurons. And so I'm very hopeful. I'm hopeful for new interventions. I'm hopeful for destigmatization. And then I think this intergenerational trauma that happens because we've had generations of people not treated well and not talking about it. And I am a believer that gets passed down, whether it gets passed down in our cells, right, in our bones, in our body. And I think we can stop
every
that.
way.
In every way.
Gets
Yes.
passed down.
Yes.
So I'm looking forward to the day where there is an app that we can actually be able to look at our own brain scans and see what we ate that day, what exercise we did. If you're like me and you just stood on your head for 10 minutes before the show, what that did to the brain, how your sleep affects your brain. And so that you can really, one has more control, much like a scale, over one's best cognitive function, best mental health.
Oh, that would be so amazing. Right. And that brain scan guiding us to, right, you should be someone who takes Prozac. You should be somebody who does TMS. You should be somebody who does an ayahuasca journey. You should be some, or all of these.
Or
right?
You should stop eating gluten immediately because it's
causing. There you go. Right. Absolutely. Right.
So yeah, lots to look forward to in the future of mental health. I guess that is the good news. So if you're listening to this show and you're enjoying what you're hearing and you know someone who could benefit, share the show with them, because the more we talk, the more we educate ourselves, the more we look at different options and viewpoints and ways to feel better, then we're serving everyone. And I am going to open up this last question to the both of you. And that is, obviously, I'm in the health and wellness field, a lot of physical, mental health and wellness. Do you see a direct correlation between obesity, being overweight, and mental health? I know studies have shown that if you're obese, your brain is actually smaller. Can you just briefly each talk on that? And we've got about 3 minutes left till the end of the show.
Faust, you want to go for it? Yeah, I'll go. Okay, absolutely. Yes, there's definitely a link in my mind to a healthy body, healthy mind. And so I'm not an expert on in terms of all the ways obesity impacts but short answer, absolutely. And I think that we learn more about obesity, right? It's not for some people just about diet and exercise. That's a crucial point, but we know more about metabolic disorders and the importance of other medical interventions. So I would urge everyone, right, if they're struggling in that department, to really make that a priority. And you will see that the mental wellness will come along with the physical wellness.
I need another hour with you. I noticed when I did my ketamine treatments, my taste for even fruit, sugar in particular, changed, and I did a lot of research. Are you seeing people who have had inability to lose weight undergo this magnet therapy or ketamine and then lose the weight?
Yes, absolutely. We see it a lot. Right. And I think it's not just they're feeling better, so they're getting out more, they're exercising more. We can include all that in our treatments because we have the interventions that we talk to them about their whole body wellness. But I think it's also related to the microbiome and the gut brain connection and the healing that happens there. And people shed weight. It's fascinating with the TMS, with the ketamine, with the interventions for wellness.
When I went for my ketamine treatment, I talked to all the nurses because I'm so interested in what they do. And one had been working at a bariatric surgery center for 10 years. And
Wow.
I said to her, I used to eat like fruit at night and stuff, and that's all changed since, I don't know, 3 or 4 treatments in. And she just said to me, that confirms a theory that I have. Unfortunately, we never had a chance to follow up on that conversation. But I did a lot of research on ketamine after that. And I have read that it does affect the gut brain axis, and it makes you create more healthy bacteria in your gut. And I felt it. I'm very obviously aware of my body, and it was very interesting to read that that was a very beneficial side effect.
Yeah. Yeah.
So, any words of wisdom for our listeners as we wrap up?
From my perspective, everything we have is inside us. And I'm just telling people, do the work, be willing to do the work, listen to podcasts like the radio show you're doing, get as much information as you can. And if you can, put a team together that is going to help you through what you're dealing with. It's usually not just one person that's going to help you. Try to put together a team. You may have your quarterback, if you will, the person that's going to come and say, well, let's get this person and that person, all those things involved. So get your team together.
Thank you. Dr. Koo, you want to give us a closing sentence?
My sentence is, yes, you should feel your best. And if you're not, seek the help you need, because I guarantee you it's out there. Trust yourself.
Great. Thank you so much for being on the show. And we will share all of your contact information in our show notes. We'd first like to thank our sponsors, YogaFit Training Systems, the leader in mind, body, fitness education worldwide, offering corporate wellness, we've got 2 conferences coming up, one in Minneapolis and one in Scottsdale in June and July. We also have a subscription platform at yogafit.com, so you can save 15% at checkout by using the code VOICE23. If you're interested in any of my books, especially Yoga Lean or Healing Trauma with Yoga, you can look for them anywhere books are sold and visit me online at bethshaw.com. You can also find me on Instagram at Beth Shaw Health. And as we wrap up, Dr. Koo, where can we find you?
Easiest, look up neurowellnessspa.com. Very easy to Google. Also clearrecoverycenter.com for intensive outpatient services.
Wonderful. Thank you. Faust, how can we find you?
It's my website. It's my name, FaustRuggiero.com. Everything you want to know is right there.
Wonderful. I'd like to thank you both so much. We never have enough time for these super interesting topics that are also very intricate. So we'd like to thank you both. Thank you to our listeners. Please share this show and stay healthy physically and mentally. Remember, it all starts with you. Unfortunately, only you can do the work. If I can be of any assistance to you, again, reach out to me off of bethshaw.com. And until next episode, also for May is Mental Health Awareness Month, let's stay healthy, America. Namaste, everyone. Thank you so much.
Namaste.
Thank you. Thank you both so much.
Thank you, Beth.
I'm going to definitely did I get your email? Yes, I did.
Yes. Okay, good.
Got your email. I will email you. And I will probably see you in Los Angeles at some point.
Okay. Or June, you'll see me in June. We find each other
Yeah,
at
all right, you know what?
the psychedelic conference.
I'm going to text you. I'm going to text you because I would
Three-
love.
Sure.
Okay.
310-980
Okay.
8368.
We are
Okay.
all clear.
Thank you. I have a 310 number as well, so I'm just going to send you a text right now and just let me know that
I'll go
you
ahead and
got
hop off here and clear the lines. You all have a great rest of your day.
Thank you so much.
Thank you. Let's see.
All good?
Didn't come yet, but maybe. Oh, there you are. Awesome.
All right, perfect. I'll see you at MAPS.
Yes, that would be great. Thank you, Beth. That was
Thank
really
you so
fun.
much.
I really much
Thank you
enjoyed it. I
so
always get a little nervous, but you made it very easy. So
It's
thank
great.
you.
Thank you both so much. Never enough time.
Thank you. Bye-bye.